Our next speaker is Dr. Claudio Rossi from Brazil, a doctor of veterinary medicine from the State University of Londrina. He completed his residency in internal medicine, small animal surgery, and anesthesiology, later getting a Master of Science in small animal internal medicine. He also qualified as a doctor of philosophy for small animal internal medicine and specialized later in veterinary dermatology. A breeder, all breeds judge of the CBKC, and a member of the World Dog Show 22 board.
And now I'm going to be talking about dog breeding with genetic inheritance, then breeding dogs selection criteria, and the types of crosses. Then the genetic basic concepts, I will be speaking about this. And I have another presentation. There is another presentation after mine, which will be dwelling on this, and also consequences of diseases on health and welfare of dogs. So we will start talking about dog breeding and genetic inheritance. We need to start talking about breed formation because it's got a direct relation with genetic diseases. And this happens because selection, breeding of these dogs and breeding of these breeds, years and years ago, was based on breed selection for morphological and functional features. So those features became selection criteria for dogs, and with this, the formation of breeds. And also, the crossing of these breeds or making other breeds by selecting other ones too, like we have seen before. For example, crossing poodle and Labrador and retriever results in another breed, and this is how we've been making new breeds. And now, about breeding and breeding selection, the types of crosses. I will now speak a little bit about the main ones we have for this selection. And one of them is aptitude, that is to say, temperament, characteristics, character, which are important when we are talking about work dogs or when we make the breeding for a specific action. We have hunting dogs. Aptitude one. Not only are they selected for their morphological characteristics, but also for the work they do. This is important. When we start this selection, we are not sure because long ago we did not veterinary was not so well evolved, and therefore we did not have health examinations and DNA tests. So, when we first started, we had a different selection from the one we have right now. And now we have to make breeding together with this evolution. It is important that we have some dogs. To make the breeding for the ideal characteristics. Let's go back to work. So this is important, absolutely, because it's a part of it. There are dogs which do their job, but we also have to think of well-being or welfare of dogs. And here, for example, in Newfoundland, a guard dog, which also does the work. Here we go, Newfoundland. If we had dogs, for example, with hypertypes, I'm sure we would not do this job. So it is important to have the dog, to have the standards and characteristics. Then we had these other dogs doing another different type of job. These are the Siberian Huskies doing the pulling, the trailing. So not only do you need for them to have the fur, but also all the characteristics to do the job in the snow. And also, they do jobs that are a part of our day. This is an example of these ones that are sniff dogs, sniffing for drugs, and in this one, search and rescue, sniffing for missing people. So they are equally important. And now we are talking about this. This is important. While we have dog breeds, it is important because they do the job for us. Surely, companion dogs, we have this for guards, households, etc. And there are other things, but they are all a part of our day-to-day life, and they share time with us, so it is important they have the right temperament and the right character. Another way of selection is pedigree. There is a way that many breeders use in selecting dogs, and oftentimes they do this considering the bloodline of the dog. In general terms, their genealogy. So, in if I see there are at least 3 generations of pedigree to have this information, and sometimes we have information about dog health. Today, we're going to have a discussion about this. A good way of doing this selection due to a character morphological and characteristics are called phenotype. What is the phenotype? Well, some of this information is in dog standards. So sometimes breeders do their job based on the characteristics we have as a part of the standards. This is an example. We have the Brazilian dog, and this is also a dog that has to be as close as possible to the characteristics included in the breed standards. And again, about the type and the conformation of their angles and features, it is all clearly described in the standard for each of the breeds. Plus, another breed criteria is genotype. Oftentimes, we have this selection to control for diseases and also colors. And this is a part of a breeding program today that is specific and has to do with health and welfare. This is an example. This is the Page, the Brazilian Page. And here we have black, these black spots which are dominating over gray. And the same happens with brown, which is dominating over light brown. So oftentimes we don't know this, whether this dog has a gene to have gray or blue hair, and genetic helps us on this. This is a tricolor, but this dog has a gene that makes the third color not appear, and therefore a genetic examination has to be taken in order to determine the color of this dog. You can only see brown and white. You don't see either black or gray or bluish, and it is important the type of crosses. Here we're going to talk not alone about this, but inbreeding crosses, which are the crosses between dogs with a close family connection. For example, the one of the father and a daughter, or the mother with a son. In these situations, we do preserve some of the characteristics, but one of the problems we may have is the presence of mutational diseases, mutations or diseases, because we are performing this selection of dogs that might have recessive or dominating genes for diseases, and with this, we are doing selection. Line breeding, when we are a bit further in this type of crossing, out of crossing, and again, in between breeds, the ones we had mentioned before. When we have lots of inbreeding, to determine the coefficient, because the higher the coefficient, the higher the possibility of having diseases in dogs. And here we see an example of dogs with high level of inbreeding. The third part, we will talk about genetics. This is not directly my talk, but I have to speak a little bit about this, to talk about genetic diseases. Then we will be hearing about the subject. It's important when we speak about chromosomes, we are talking about a body carrying information, and this information is present in the cell nucleus. They are basically made up of DNA and protein. But why is this important? Because dogs have specific pairs of chromosomes for the species, and similarly, other species have their own specific genes. In dogs, there are 38 chromosomes called autosomic, and again, these chromosomes determine the key characteristics of this species, in this case, for dogs. And the sex determination, X or Y, determines, again, the sex of the dog. So here you can see if they're all similar, these other ones are autosomic. In terms of genes and locuses and loci, these are the units of inheritance which occur in specific loci. This determines the characteristics of dogs. And so in this example, we have a minor difference in the nitrogenated formation of DNA. It is not good or bad. It only determines that this dog has X or Y characteristic. But it's so fine. It's different when there are genes connected with a disease. Here we are only mentioning characteristics. So both okay, no problem with that. In terms of alleles, we should discuss alleles because here we can talk about diseases at the last part. But what are the alleles? The They are alternative ways or alternative varieties using the same space or homologous position non-chromosomic, and it determines a specific characteristic, a given characteristic, and their actions may result in different expressions of genes. An example of this, we have a male and a female. This one, for example, has two alleles with dominant alleles, and here we have recessive alleles, and here we have the formation of the third one with a capital A and a small a. But what is this? When we talk about homozygous, then you can connect when they have the same type of genetics, and heterozygous when they have both. So this is the key difference. But why is this important? Well, it's important because diseases have a connection with this type of inheritance. Take this for example. If we spoke about the phenotype, which are external characteristics, but it is definitely connected with genotype, because if your dog has signs of a disease, it's because the dog carries the gene for that disease. On the other hand, genetic. And here, there is genetic data of a unique and characteristic genetic sequence of an individual. By contrast, here, these are some of the examples we take when we are to make dog selection for breeding. We look at lots of things, starting with the phenotype, that is to say, qualitative characteristics which are connected with breed standards. One other important thing about diseases is their dominance. Basically, what can we do with this? There are some phenotypes that are dominating. What does that mean? When there is a dominance as compared to the other allele, which may be recessive or polygenic, the dominating allele becomes a trait by itself by being heterozygous or homozygous, dominating her. The heterozygous are the ones described with a capital and a small letter. So in those dogs, you will see the disease. It is different from a recessive allele, because in there we have genetic with a recessive homozygous. So on this side, we have determination. If we have a father and a mother with the same phenotype, when we make the crossing, we get all the progeny with that disease. So this space to get them from the breeding center. But on the other hand, it is not good when we perform the crossing. And polygenic are multifactorial, and they have an influence by multiple genes and also by the environment. This is an example. Elbow dysplasia, hip dysplasia, these are polygenic genes, which also have an action of the environment to be shown. In terms of dominance, this is an example. This is curly hair or hairless. In one of them, it is dominating over the other one. And the same things happen when we have the short hair and long hair. So these are dominance characteristics, but the ones that are not specifically connected with the disease. And one more thing, there is a connection in the absence of teeth and the absence of hair. So this is a direct relation of a the genetic content. And here we have different cardiopathies. One example of this. In here we have the cardiopathy of boxers. This is a polygenic characteristic. And for example, this is different. No, no, no. Here this is autosomic dominating, which is different from cardiopathy. And here it is definitely polygenic inheritance. And the last part of it, let's talk about these diseases. Concerning the types of heritability, autosomic recessive, autosomal dominant, we spoke about them. The ones connected with sex, like chromosome X and the anomalies of chromosome plus polygenic. So we end up having lots of types, and if though this designation is not known or is not complete, we have lots of types, and that is why oftentimes we need to conduce genetic tests in order to determine whether the dog has this is bound for a disease or not. And in reviewing this, I'm sure we don't need to talk too much about diseases, but I will just spend some time talking about the main ones. We have encountered musculoskeletal, like patellar the dislocation is quite common in small breeds. So this is a type of disease we encounter often, and I'm sure that in order to have a diagnosis, we oftentimes need to remove the dog from the breeding center, but veterinaries are very important for this. Hip displacement, dysplasia. Again, this is more bound in bigger breeds, particularly in the big ones. We also have the elbow dysplasia, and we do need to remove again elbow dysplasia for larger breeds with the same with this, which are the ones showing hip displacement. And also another one talking about muscular problems, abdominal hernias. These are more common in small breeds, and it is equally important that a proper diagnosis is made prior to the to treating, because we may have the hernia and complication with offals, and that will result in more problems for dogs. Eye diseases, many of them are found in dogs, and therefore it is important for each person, each breeder, and veterinaries to bear in mind what is important for breeds. I mean, it is not impossible to have a disease that is uncommon to a breed, but it may happen. Although it is important for them and for dogs for us to have these diseases in mind. Cataracts, for example, this is here, opacifying, and with this, dogs don't look good, and this usually leads to blindness. This other one is called the cherry eye. In here, we'll have the collapse of this gland, which sits in the third eyelid, then ectropio, when you see the lower eyelid and eyes are exposed. In here with entropia, and surely in all of this, it would be very likely that when we look at people and when they have their dogs at home, when you find this in your dogs, take them to the veterinary. This is an excessive exposure of ice. This happens in some brachycephalic breeds with red eye due to conjunctivitis or excessive exposure of ice. And in here with glaucoma, which is genetic as in humans. Skin diseases. Allergies are quite common. In our clinic, it is very important to treat this kind of disease. The most common one is atopic dermatitis, but we also have allergies to food or the, the stinging of fleas and ticks. The black munch, it's caused by another parasite, and it is also genetically transferred. And oftentimes the problem is that there is not an early manifestation in the life of dogs. And this is a problem because if we don't see an early manifestation, we can find it much later. And by then, dogs may have already had their progeny, and therefore the disease is passed to the next generation. And then the so called primary scaling or sebum, due to the presence of sebum and dermatitis, dermatitis for the excess of skin. We spoke about this a few minutes ago. So see how much skin in this dog. And surely this is not healthy. This is not good for the dog's welfare. And oftentimes this results in many secondary infections and in general skin challenges. Cardiorespiratory diseases. The most common ones are number one, the this mitral valve is much more common in smaller breeds rather than the larger ones. And I'm sure these animals have clinical characteristics of these diseases. But the problem comes when we have a male and a female who have offspring, and then the problem is identified because all the offspring might have inherited the disease, and at some point they will come to the veterinary, perhaps in the next 2 or 3 years. But this is the challenge. Once they have had offspring and disease has not been properly diagnosed. And there is one more subject which we don't need to discuss right now because there will be two more presentations. But basically, it is the importance of, of this example: a dog with an occlusion of airways, nasal airways, and surely time will have a consequence on health. And the last part of it, endocrinous diseases. We have thyroid disease, which is a deficiency of hormones. It's 2 or 3 out of 4. And also another challenge here has to do with the previous ones. We oftentimes have a clinical manifestation of the disease with 8 or 9 years or older. So after this time, the dog has mated many times and will have many a big offspring. And this other one, called the Cushing syndrome, by the increase of abdominal volume, and it also results in higher water intake plus more times that animals urinate. But again, This starts after dogs have had offspring, or even if they had a good health along their life. And diabetes, which is insulin deficiency, is also important. There are some breeds that are predisposed. It's important. An example of this, poodles. We have some other ones, and the same thing happens. Oftentimes, manifestation is late, so genetic work is important, veterinary work is important to treat these diseases. And here we have some more information about other diseases. It is not possible to cover all of them, so these are other important diseases. And again, in larger breeds or gigantic, we have dilatation or gastric torsion. The problem here is, again, when you see this acute the acute symptoms, and if you don't have much time to respond, there's not much to do. Kidney disease, urolithiasis, and idiopathic epilepsy, and neurological syndromes with specific breeds with episodes of convulsions. Plus, this one here, we have a description in standards about the presence of these balls in testicles. This is important as a part of our evaluation, and it is often that we find a different consistency we identify by touching. So it is important when we evaluate, we we have to pay attention because this may not be the right one to treat at the given time. So, and some final considerations. It is important for us to be responsible when breathing. The work we do is important for preservation, promotion, and improving the breathing of breeds. We need to have a careful plan for breathing and also genetic control of diseases and also control of colors when there are diseases connected with colors. I'm sure it is necessary to accompany dogs on a day to day basis when there are problems or when we have diseases connected with these breeds, performing veterinary or genetic examinations. This shows the latest. And I'm sure with this, we try to have a good health and a good quality of life and welfare for dogs. And also, I'm sure for humans, it is important to see their relationship with us and also the work and the support they give to us. Thank you very much. And I encourage to every one of you to come to Brazil. We're going to have the World Dog Show in December. You are all welcome to attend. Thank you very much. Thank you for this great presentation by Dr. Claudio Rossi. Are there any questions in the room? Questions, doubts about this presentation? All right, Julio. Hi, Claudio. We are seeing in the market many, lots of grain-free feed because we have encountered many animals that are intolerant to grains. So would that be considered as a disease in dogs, or is that something not to be too concerned about? Well, today you can consider that these dogs with some type of allergy may be connected with today. There are lines working on this theory, and the problem of the feed is just to cover the needs of dogs. I'm not sure, and I don't know if this problem is present in Europe, but in Brazil, right now, there are many people to handling with natural food, but they don't have all the nutrients that dogs need. And then with time, we have problems with the skin or others. But this is one of the most prevailing ones. That's a problem we have in Brazil.
Gracias.
Hi, Claudio. I had a Welsh Corgi who was already about 8 years old, and she was diagnosed with Van Hildebrand's disease. She was bleeding, she almost died. They had to open her up and seal it, cauterize it, and everything. Now she had about 3 litters before that. Does it mean that all her puppies will have Van Hildebrand's disease?
I don't know specific in this disease. I don't know if 𝐂𝐨𝐬𝐞 can help us. No, I don't know in specific in this disease.
Good afternoon. In listening to you, I couldn't hear anything about degenerative myelopathy. I think it is important because there are lots of dogs undergoing this condition. Some of them are just carriers, some of them are affected. Well, degenerative neuropathy, as compared to these other diseases, there is less and less than this all. And there are many other diseases I didn't even mention today, but which are important. I'm sure there are some breeds, for example, pugs, with the prevalence to this disease. That is why it is important to work from the breeding and selection to identify the most common or the most serious diseases in breed lines or just in breeds in general. Bien, muchas gracias, Claudio. Excelente presentación.
I want to thank the FCI board members for giving Mexico the opportunity of having this important World Congress for Welfare and Health for the dogs worldwide. We are really pleased and thank you so much for giving us this great opportunity. And also I want to thank all the speakers from all over the world who participate in this great event. Thank you.